Consumer advocates predict that health insurance rates will soar when the Affordable Care Act takes effect in January. That raises the question of whether California should regulate health care rates or leave it to the insurance companies. NBC's Whit Johnson has more.
Under the president's health care law, the White House plans for the first time ever, insurance companies will have to publicly justify any rate hikes of 10% or higher. But a consumer advocate group argues in California, there's no power of enforcement.
It's going to be a financial bloodbath for the people.
Consumer Watchdog founder Harvey Rosenfield has an initiative on next year's November ballot that he says will help keep insurance companies in check. It would put health insurance under the umbrella of Prop 103, which he authored. It passed in 1988, creating the toughest regulation in the country, making California the only state where car insurance is cheaper today than 25 years ago. Prior to that law, when car insurance was mandated, premiums jumped 22%. Rosenfield predicts history will repeat itself when the Affordable Care Act requires everyone to buy health insurance.
I have no doubt that insurance companies will try to take advantage of this law to increase premiums on everybody.
And they point to recent history. Just last April, State Insurance Commissioner Dave Jones called Anthem Blue Cross's double-digit rate hikes for small businesses excessive and unreasonable. The month before, he said Blue Shield's nearly 12% average rate increase for individuals was also unreasonable and asked the company to reduce it.
But because no one in California has the power to say no, they went ahead and imposed those anyhow.
Consumer Watchdog says putting health insurance under Prop 103 may be the only way to keep the Affordable Care Act affordable for many Californians. But the battle against it is already being waged by opponents calling themselves the Californians Against Higher Insurance Costs campaign. Spokesperson Robin Swanson.
Creating a secondary layer of bureaucracy that undermines the ACA before it even gets off the ground in California is exactly the wrong way to go.
How do you think Prop 103 would undermine the Affordable Care Act?
People are negotiating rates at the outset that are surprisingly low, and then a secondary layer of bureaucracy comes in and says, nope, those aren't going to work. Then what are you left with? You're left with nothing.
Over the years, Insurance Commissioner Dave Jones has unsuccessfully authored legislation to regulate health insurance rates. If voters approve Consumer Watchdog's initiative, insurance companies would have to meet guidelines for rate hikes, and those hikes would have to be approved by the commissioner.